give us a little presentation, and then we'll have a few minutes to ask questions. Anything before that? Everybody knows Lisa, or they will now. There we go.
Lisa is a long-standing REACH employee and high level. She was Associate Executive Director for a number of years before she went off and to other journeys there. And I think today we're talking about our REACH's performance system. It's not new, it's just that we've packaged it differently.
Good, thank you. And Lisa, you're more than welcome to stay for the rest of the meeting and get to hear the numbers, the black and red numbers. That's always my favorite part, black and red numbers. But if you don't need to and you want to go and have dinner, you're more than welcome, whatever you like. Thank you.
Thank you. Yeah, I think I will just do my presentation and then I'll bow out after that.
No problem.
Nice. Do your thing. Yeah, like Rini said, it isn't a new system. It's the system that REACH has been using for a long time. But because it's so comprehensive, it is fairly complex to wrap your head around. So we thought that with CARF coming, so part of my role has been to help put things together for CARF, and with CARF coming, it's just helpful to have it laid out in a way that's more easily comprehended. And then once we started looking at it, Rini thought it was a good idea to share it with you guys as well. So some of you are very well aware of what happens, but some of you may not be. And it's nice to just see how it all connects and how good REACH is at getting stakeholder input and using that input and getting information from a variety of sources to plan, do their strategic planning for the coming years to make sure they're addressing all the priorities. So I'm going to have to share my screen here. Hopefully this works. Okay. No, that's not
Well, it said you're starting your screen sharing,
it.
but then we lost it.
Okay. You got that?
Yeah, it's working now. Yeah, it's just not in the right place yet. Yeah. Just have to get to the beginning of this. I'm not sure where the beginning is. I don't think that's it though.
Yeah, this is blocking my arrows from me.
Oh.
Your faces are blocking the arrows. So maybe I can make this, okay, here's the
beginning. Change your view maybe.
Ah, perfect.
Okay, welcome to the timeline for REACH Society Program Management and Measurement Cycle. So we look at planning, but also we want to measure everything that we're doing so that we can see what kind of progress we've made, whether we've met the goals that we've set, and whether we should revise those goals or change them going forward. And, you know, if we haven't met goals that we've met, we want to understand why we haven't met them. Sorry, I still can't seem to access the arrows.
Oh.
Move this over here.
If you change your view, it might work, Lisa.
Oh, I changed my view. How do I change the view?
Oh, see view options up either at the top or the right-hand side at the top. View options.
Oh, the very top. It's at the very top.
Yeah, the very top.
It's a standard side-by-side gallery.
Oh, it's okay.
Exit full screen. So it's on standard right now.
If you put us down the side, it might work better.
Side by side, I wonder if I can do that. So side by side gallery or side by side speaker? Speaker maybe?
Well, if you just put the participants down the side, yeah.
I'm just hiding everybody now. So
yeah,
I can't see you. I'm speaking to a void, but this way I'll be able to adjust things, I hope.
Yeah, we can still see everybody. Well, pretty kind of, some people.
This, I still don't have my arrows.
Oh.
Okay. Okay, so these are the months so we've organized this in terms of what happens every month. And why don't we start with February? So this is the whole cycle. We don't have something every single month, but some months are more crowded than others, as you would imagine. So for February, so this month we've collected back the satisfaction surveys, and so those survey results are coming back, and those are going to be looked at in terms of so the results are summarized to be used as sources for data for strategic planning, determining whether outcomes were achieved, new outcomes planning. The summary is distributed to programs and executive for planning. And in the summary, we will highlight the areas of improvement from previous years, areas of decline, positive comments, and ideas for new goals.
And those satisfaction surveys go out to our families, all of the families that we support.
And there's 12 questions, and they're, about, are you happy with the service you're being provided with? Do you feel that your staff person from REACH is well qualified and respectful?
Has your capacity improved, your parenting capacity improved?
Yeah, and has your child improved as a result of the service? So there's 12 key questions there, and it gives us very valuable information. And for the most part, on almost every question, we typically score between 90 and 95% positive. So either they agree or strongly agree that they are happy with the service. So it's very useful feedback for us.
I think you went backwards there.
Yeah. Okay, so March. What happens in March? The program outcome reports are due, and we work on a broad environmental scan. So each program at REACH does an outcomes report. So each year they set goals that are in terms of efficiency, effectiveness, and satisfaction. And those goals are based on information from the family satisfaction survey, information from kind of a broad scan of the environment, direction from the executive, direction from the strategic plan, what are the priorities in the strategic plan, and how do those flow through into the program outcomes and priorities. And theirs are also more specific, and they'll have to do with things that are just specific to their program, like if one program has a wait list, it might be a goal for them to establish a wait list service for that particular year. Reduce numbers of families waiting to connect, or reduce the time between connecting with REACH and service provision. So those kinds of things. Feel free to ask any questions too as we go along. And this is the broad environmental scan. So here, this is part of what goes into strategic planning as well. So we'll have the family satisfaction survey feedback. We'll have feedback from outcomes that each program has set. And at the QUIC committee, the Quality Improvement Team Committee, they're also identifying these sort of more broad factors that need to go into strategic planning. So things like social determinants of health. So if there's anything changing, if there's sort of an increase in poverty in our communities that we serve, or there might be changing demographics that we need to attend to. There might be changes in the political climate, and there could be kind of clinical changes in terms of best practices. So that group will look at those things, identify those, and that information goes to strategic planning as well. So we have a number of committees that staff sit on. I think there's probably 12 different committees, and some of them are provincial, some of them are more local. But it's from those committees that people gather information about the communities as well. So we sit on a child and youth committee. There's Rini sits on the BCACDI committee, And within, there's the early years committee. So there's a number of them where there's new directions that are being discussed at those committees, and REACH is in on those discussions and bringing that information back so that we're in touch with everything that's happening in the community.
So if I can just add, this is a slight change in our process, an improvement in our process that Lisa recommended. Here in the past, we just did the broad environmental scan when we did our strategic plan, which is, every 3 to 5 years. And then, if something came up in between, we'd modify our strategic plan. But now we are going to look at as a senior staff and then ask the board as well. So we'll modify your board calendar as well for March, April-ish, I guess, Shelley. For your input as well. So things like we've already talked about at the board level, in addition to the examples Lisa gave, the changing roles of the educational system as it relates to childcare and the potential that our services could end up there as well. And so, we'll look at that and see, are there opportunities for us? Are there threats for us? Those kind of things. And then, after with board input and discussion, we may modify our strategic plan to reflect perhaps an increased presence of REACH within childcare. Now that it's probably going to be funded over time more appropriately. So, obviously we go through a process. That's just an example of something I can see forthcoming from the review that's up and coming. So this annual scan, I think, is a very healthy process, and pulling the senior management team into it as well is both new practices for us, so the increased frequency.
Thanks, Rini. So April, I think, is a busy month. We have the overall society's outcomes report. So for each program, there is an outcomes report, and those are kind of tallied up at in March, and then or end of March, beginning of April, and then in April, one person, it would be either Rini or Katie or Kelly or myself, to pull together the overall society's outcomes report, which includes every program. And it includes the goals for the overall society. So we have that year-end result. Sorry, went the wrong way.
That's okay. And while you're talking there, so, our board also has its outcome goals there. So they're tallied up and analyzed and updated as well, and incorporated into this process.
Then there's annual plans that need to be updated. These include technology, risk management, accessibility, diversity, and legal regulatory compliance. Then the strategic plan and society-wide outcome goals are developed. So we have all of this information. It's almost going to write itself, the strategic plan, and because we have all the input from the family satisfaction surveys, the overall outcomes report, the program outcome report, and all these annual plans. And it has been the case that Rini's been responsible for writing most of these plans. So that's something to look at as well, whether the QUIT team can also be involved in that. So
yeah, I think so, Lisa, particularly, with my retirement, coming in the future here as well. It will only strengthen the organization to do it through a broader process.
Okay, so in May. So here's the new outcomes for the coming year. So we've done the roll up of all the other outcomes, and then so these are new goals set after the strategic plan is set. So this isn't how it happens right now, and this is kind of still a proposal. And Shelley pointed out to me that the outcome goals typically are set around the same time the other ones are rolled up. So this is something still kind of under discussion, whether we need to wait for the strategic plan to be done before those outcome goals are done or not, or if they can just reference the old strategic plan. But that's one essential piece there, regardless of when it happens. June, I think, is time off. Yes. So June, July, August. Well, June, actually, we're going to move to June preparation for the AGM. Right now, I have the preparation for the AGM in August, but Shelley also pointed out to me that we need to start earlier than that for preparation. So that will be part of what happens in June. So July and August will be free. So the AGM happens in September. And so this is the stakeholder meeting where we share all the information that we have, also celebrate the accomplishments, select new board members, invite feedback, and facilitate relationships.
What do you think? Will we be there?
In person?
Yeah.
No, not yet, I don't think.
September? Oh.
I'm sorry, this is quite finicky, this.
That's okay. And so that the format that's shared to the AGM attendees is within the context of the president and executive director's reports at this point in time.
And there's typically good food too.
Yeah, be your own kitchen.
In your own kitchen, yeah.
Yeah, unfortunately. So October is when a midterm update on progress toward outcomes is done. And this isn't a formal plan that's put forward, but every program has a make sure to look at their outcomes at this point to make sure that they are on track. Sometimes at this point in time, if you look at your data that you've got back, you might decide to tweak things a little bit. Sorry, my fingers are. Okay, so that was October, November. The Board of Directors does their midterm review of outcome goals that time. And again, it's just a check to see, if you're on track or if you need to tweak things a little bit, change things at all. December, we're just beginning preparations for the family satisfaction surveys, and that just, it involves the whole organization because we do get a very good turn back rate for the surveys, and that's because the coordinators work closely with their staff to make sure that families are aware of it, they're getting the message. Families who don't want to do it online, typically what happens is the staff who go into family homes will bring it with them and help them with it, or encourage them when they see them to fill it out. So it is a project that takes a little while to get the word out and to get all the surveys back.
And we do this every year, correct?
That's right, yeah.
We are, yeah. For a while there, we started to do it every other year, but it just wasn't adequate.
Okay.
So we've gone back to every year.
Okay. That was going to be my comment. Is it worth doing every second year? But you've tried that.
Well, when we're required to report on our outcomes on an annual basis. And if we do the surveys every other year, we don't have adequate data to do that. So we wouldn't have the current satisfaction survey data. So then what we were doing was basically reporting on the previous year's data, which, isn't very research-based.
Not necessarily accurate, yeah.
It's not. But yeah, we were thinking about the load on families when we did it and just on the organization. So we tried it, but it's not the way to go.
Okay.
Mm-hmm.
It's a huge point that CARF stresses too, to make sure that we're getting ongoing feedback from families. And we do get ongoing feedback through the staff who are working with the families, because they'll bring forward any kind of concerns or information that they have to their coordinators. There's team meetings that every program has, and so they can discuss them there, and then the coordinators bring that to the coordinators meeting as well. But CARF is also looking for, a more formal and, I guess, more anonymous kind of way for families to express the way they feel. So,
And are they the same questions every year?
pretty much the same questions, yeah.
Okay.
Yeah, we tweak them a little bit from time to time there.
We've
I
added
think,
a few about the about COVID, about the pandemic, and how
yeah,
we're doing
yeah,
with
we
that.
added
Oh,
that
right.
one this
Yeah,
year.
yeah.
Yeah.
Okay.
Yeah, we like to compare year to year as well,
Yeah.
and so the questions work well for that.
Yeah.
Good.
Okay, so January. So in January, there's plans that each coordinator does for the ministry, and this is when the negotiations, the contract negotiations happen. I don't know if you want to say more about that, Rini, but.
Well, I just developed a template for reporting to the ministry, which basically lists the program service deliverables and whether we met them or didn't, and why not if we didn't. So let's say we had a vacancy for a period of time, then our direct service hours might be low there. So we would report to the ministry on that. And our outcome goals for each program that Lisa talked about, we update those for the ministry and share them with the ministry and discuss them. The template also has questions, comments around, what worked really well this year in the program and where the challenges lay, and any recommendations that we have that we want to discuss with the ministry regional. We're very lucky to have in the South Fraser region a ministry that is committed to working in partnership with us. And is very supportive there. So we find the year end, and then our contracts may also get changed at this point in time. So this previous year, remember we were running deficits in a number of contracts for a number of years there, and the ministry really wanted to go through our bookkeeping and all of that to make sure before they agreed to reduce they didn't have any new money to address our contract deficits, and we didn't want to really keep proceeding with deficits as we move forward here. So we had to reduce our staffing levels within the contract. So less staff for the same amount of money there, which of course we held off on as long as we could, because we don't like to do that. So that came from our year-end meetings and discussions with the ministry. And of course, the board was actively, and the executive were actively involved in that, because part of our financial stability related organizational goals is to not run deficits in any of our programs, because that in the long term can put the organization at risk.
And it's always been a great opportunity for the coordinators to meet some of the ministry representatives as well, and for the ministry folks to kind of hear about the positives and the problems within the programs, and just learn more about us. And I think opportunities have arisen as a result of that for REACH. Like, I think the program that Camille runs is one that was identified because they knew who we were and what we could do, and we ended up with a contract to provide shorter term positive behavioral support as a result of that.
And the TIP program, where we're helping to move kids that are in care, that have support needs, out of care or to the least restrictive environment there. And it just was not happening in the past, no matter what the ministry tried to do with the service providers. And so they like our behavior support approach there. And so they asked us to apply that to their goal of of moving individuals to the least restrictive environment possible, rather than keeping them in the same place. What can happen in group homes, et cetera, is once folks get settled in a program there, it takes a lot to get them settled. The tendency is to just want to keep them in that program too. So it isn't always in the best interests of the group homes to encourage that. So the ministry, because of our knowledge in behavior support, which incidentally Lisa brought into our organization a million years ago, the whole behavior support thrust there. So yeah, so that, and now we're also, it's a smaller contract that we're working with the ministry on there for undiagnosed in young people who are struggling and often have mental health issues. And we're so lucky, we have 2 behavioral analysts who are also clinical counselors there. So we're doing what other organizations and the ministry has not been able to do because of that unique skill set that we have, and again, our behavioral approach. And it does all come from the partnership that we have with the ministry and the discussions that we have at year end.
And it's good to have all of this information pulled together at this point to be able to present it to the ministry, and so they get this whole picture as well. This is also when the new CARF manual comes out, so there's just a review of that manual to see if there are any new standards for the new year, and then those are reviewed with staff, and we have to see if we need to make changes in policy or practice or add things as a result of that. There's also the health and safety critical incidents report that's done. So every year, a report is developed based on information reviewed by the Health and Safety Committee, where trends are identified and recommendations made. There aren't, all that many critical incidents that happen at REACH, but when there is a critical incident, what happens is the Health and Safety Committee has a look at it, and there's a change that happens as a result of it. And then if there's any kind of a trend, then that's reported on, and there's new kinds of measures put in place to try and address those. But there's that annual report every year that the Health and Safety Committee develops.
Lisa, there's a question from Linda on what CARF stands for.
Oh, sorry.
That's okay.
No, that's okay.
That's a good question. They don't spell it out very often, do they, Rini? It's the association.
It's a Council on Accreditation and Rehab for facilities or something like that. They just use the acronym CARF, and they're US based, but they have Canadian branches. And I don't know, there's thousands of standards that we're required to conform to. And not only do we have to conform to them, but we have to show evidence of conforming to those standards. And for the Ministry of Children and Family Development, which provides the bulk of our program funding here, it's a mechanism for accountability for them. So they know that, there are standards in place for programs across the province that and that there's an external body that comes every 3 years. And so we're doing a digital survey this year, so like an online one, but it'll be 3 high-level surveyors for 3 days there that will be going over our conformance with those standards. So it'll be our first ever virtual survey, and a heck of a lot, which is why we're so happy to have Lisa back and helping us with this. We have to upload all of our evidence on how we conform to those thousands of standards on the team's site there that we'll be using and sharing with the surveyors. So yes, so it's really our accountability framework.
And I mean, CARF does audit social service agencies and behavioral health agencies across Canada and the US. And I think if you have a certain number of people that you serve or a certain number of employees or a budget of a certain size, and you're not CARF accredited, you won't get government contracts.
Right.
So it's kind of a requirement.
Yeah, over 500,000, I think, in income.
Mm-hmm.
Yeah, we're required to do that.
Great. Well, thank you.
Good oversight for the community. Okay, that's about it then. Any questions?
No, it's interesting that you do it on a whole year and you can really see the progress and the one dependent on the next to the next, and then the cycle starts all over again.
Mm-hmm.
So it's well laid out. Yes, thank you, Lisa.
Thank you. Yeah.
Yeah.
How many programs does Reach run?
About 10 or 11 programs.
And they all have a bunch of letters and you have to figure them all out. And
I'll work on that one.
it's a hard one.
There is a list of acronyms somewhere, I think. Is it in our board manual?
It's in the board manual there. But sometimes we look at our programs instead of using the acronyms, but more from the function of the programs, and I think that's a bit easier to understand there. We provide help or early intervention for young children there under 3 years old in the infant development program, and then we provide support to preschools and daycares under another program, and we have therapy programs like occupational physiotherapy. We have and speech therapy. We have a number of programs that focus on behaviors and behavior support. There tends to be more generally for accessed by our youth, but sometimes we're able to get younger children in that. So let's just say there is a youth that had a cleanliness issue or something, and they weren't bathing there. No matter what their caregivers try to do, we go in and try to understand why that's happening there, and work with the family to develop some strategies to overcome that challenge, because again, all of the work that we do is within the context of quality of life. And so if someone isn't bathing, for example, it's harder to have friends and, have a job and those kind of things. So it's important. So we have behavior support, families get respite as well. Those are kind of the functions of the programs that we provide.
Well, it sounds like you guys are an amazing bunch of people, and I'm very proud to be part of you. I did do some reading up, and I'll tell you, it's going to be a learning curve, but it's very impressive.
Well, thank you. We're an older organization. Lisa, we're reaches about the same age as you, right? So
Yes, yeah, 1925. 61.
61 years old, and so
Isn't that interesting? Like I said, I'd never really heard about it before. I mentioned it to my niece. My niece is a CDC worker in Fort St. John, and I actually talked to her today, and they actually have heard of Reach up there.
Yes, because we're part of the BC Association for Child Development Centers, so province-wide. I'm a co-chair there. And so the executive directors work together through that organization to share knowledge. We've shared a lot of our autism knowledge through that network, and they share information back. And we also, where there's issues, let's say should our services be shifted over to the school district, for example, well, that's a province-wide decision and a province-wide issue. So rather than having Reach advocate on its own, our impact is much stronger when it's the whole province of child development centers advocating there. So yeah, so that would be how we're familiar with each other, is largely through the BC Association of Child Development Centers.
Excellent.
I just wanted to add to, when you asked how many programs we got, we didn't answer immediately, because one of Reach's values are to be responsive to the community. So there have been, we do add new programs, they change, like the TIP program that Rini mentioned for trauma. The TIP program and the Choices program are both new programs. And things, we respond to the need in the community. And then there's some temporary groups that come up, youth groups, or, you know, there was recently a Lego group that got together. So response to what's needed and what we hear at these committees such as BCA CDI and other community committees.
Yeah, so essentially you've got your core program, but you can expand as needed.
Yeah.
Excellent.
And often we use fundraised dollars for some of the expansion work that we do too. So,
Oh,
and
that's
we'll
what I'm
use it.
interested in.
Yeah, that's why I'm mentioning that. And you know, like Elisa was saying, you know, one example of an outcome goal might be to develop a waitlist project. Definitely in the area of waitlists, we've used fundraised dollars. We're also noticing that, you know, within COVID, in the general population, we're all aware that the, you know, incidence of increased mental health challenges there. I think it's 1 in 4 people are reporting increases in mental health challenges. So, but in our children and our parents, it's even higher than that. So we've used fundraised dollars to help to support those families because we see that as one of our top priorities here. And then, you know, with Shirley Ann Reed here, she's the, you know, she's on our board here, and she'll be speaking later about the Delta Housing Be Mine, and is a very strong advocate for adult services. And there's, you know, the board was surprised through Shirley Ann and other family members that, you know, adults aren't being served adequately there. So we know that we have limitations, so we're trying to do things in small bites here and not get overloaded, because we're quite efficient and not overly resourced in any way here, probably underly resourced for what we're doing here. But you know, the issue around inadequate services for adults was raised, and so we looked at our constitution and we expanded our constitution to kind of cover the new definition of youth, which is up to age 25 at least, or move into adult services. We haven't done too much there yet, although Shirley Ann's been doing a super job of stimulating affordable inclusive housing there. And we opened up one of our group programs that was a teen program to young adults as well. So like Lisa said, we try to be responsive, and we say that the only constant at Reach is change.
Yes.
And the other thing that you know, you talk about sort of the vast programs and the infrastructure that we have, we're very much committed as one of our philosophical principles, really, to continuous quality improvement there. So we're always looking at what we're doing and how can we do that better? How can we use these resources in the best way possible? And we're not about getting bigger for the sake of getting bigger. We're value-based organization, and we're about making a difference in the lives of families and supporting the community to help us do that there. So yeah, so you won't see us out there to sort of tooting our horns so much there, because that's not really who we are. We have historically been, you know, a little bit quieter about what we do. So I don't know if that helps at all to give you a little bit of background.
No, it was good.
Growth.
Yeah, thank you.
Are there any questions for Lisa before she leaves us?
Not sure what my husband made for dinner, but
We can't even
We're
smell
totally
it.
ready for it.
I just want to thank Lisa. It's been a heaven send to have her here supporting us during the CARF process and now beyond there. So we're getting in, and we'll talk about this at another meeting because we've got a pretty full agenda, but Lisa is helping us in some other areas as well now here. And we're very fortunate.
Well, it was a
Thank
pleasure
you,
to meet
Lisa.
you, and I hope one day to meet you in person.
Yeah, we all want to see people in person.
Yeah.
Thank you so much, Lisa.
Thanks, Lisa.
thanks, guys.
Thanks. Bye-bye for now.